Good morning. We begin Fast News with the latest news of the African continent. Today, May 25th, 2014, where 5,000 cases and counting are infected in Africa by the virus known as Ebola, with a 90% fatality rate. Stay with us. To contextualize what is happening, our journalist Dalila Castro will offer us some notes about this disease, considered the most dangerous one of the year so far.
Thank you, Alejandra, and good morning to all. Today we are going to make a resume of the principal aspect about Ebola virus. Ebola virus disease, also Ebola hemorrhagic fever, is a highly contagious disease of human and other primates. The virus is spread by direct contact with body fluids, such as blood, of an infected human or another primate. This may also occur through contact with an item recently contaminated with Ebola, and spread by the disease through the air between primates, including humans, have not been documented in either laboratory or natural conditions. Semen or breast milk of a person after recovering from Ebola may still carry the virus for several weeks to months. Signs and symptoms typically start between 2 days and 3 weeks after contracting the virus, with a fever, sore throat, muscular pain, and headaches. Then vomit, diarrhea, and rash usually follow, along with the decreased function of the liver and kidneys. At this time, some people begin to bleed both internally and externally. The disease has a high risk of death, killing between 25 and 90% of those infected, with an average of about 50%. So far, no specific treatment or vaccine for the virus is available, although a number of potential treatments are being studied. This is Fast News, and I am Dalila Castro.
And to remember the beginnings of the Ebola virus, we pass on a portion of the press conference made in 1976 by the doctors Bouchard and Lugaza, the first researchers of this terrible virus.
Thanks to all media for being here tonight. Now we're gonna start with the very strong questions.
Good afternoon. I am Dariana Reynoso from the New York Times. My first question is to Dr. Lugaza. Doctor, some officials of Jambuku Hospital have confirmed that you knew about the illness that appeared in Ebola River a week ago. Why you didn't report them?
Maybe many of you think that the wisest option would be to report the Kinshasa incident, but I thought it was prudence to wait for other symptoms. I didn't want to alarm the country.
Doctor, what could be the consequence of your negligence?
Mr. Reynoso, I don't know. I'm not able to read the future. I'm a science woman, not a witch. Anyhow, the epidemic will emerge. Everybody seems to blame me for the propagation of the disease. Am I guilty for the existence of Ebola? I'm an outright doctor with an impeccable curriculum. Anyway, we wouldn't do too much. Now, we can only take security steps for avoid worse consequences.
Hello, I am Daniel Gonzalez from BBC. I have a question for Dr. Bouchard. Dr. Bouchard, the decadence of the system of health of your country had an influence upon the spread of the virus.
Of course, great part of the problem resides in the deficiency of our health systems. It is also true this situation took us for surprise. The first registered case was Mabalo Loquela, a professor of 44 years old that returned for a trip for the north of Zaire. Their high fever was diagnosed like a case of malaria, and in consequence he was treated with quinine. Loquela returned to the hospital every day, and 1 week later their symptoms include uncontrolled vomits, bleeding, diarrhea, headache, sickness, and breathing for breath. Later it began to bleed for his mouth, nose, and anus, and dying in September. 40 years later the first symptoms appeared.
Again, what measure will be taken?
The virus of Ebola, as all the hot virus, doesn't have cure or any specific treatment. The treatment that is used at the present time is to maintain the person's life by means of methods of resuscitation and to control the hemorrhage insofar as possible. As for vaccine, they are carried out investigations, but this gets complicated because all the proteins of the virus is still unknown, and because there are only 5 laboratories given to work with this virus. These laboratories are in United States, Canada, Russia, France, and Germany.
Do you hope to get international support?
We hope the international community is mobilized to our favor. This virus is like a bomb of times that can expand all over the world in any moment. The Ebola is not a problem of Africa, it's a humanity problem.
And now we go to Sierra Leone in Africa with our reporter Diaz-Santos. Dario, how can you describe the situation there?
Thank you, Alejandra. As you can see, we are in a hospital in Sierra Leone where the situation is quite complicated. The number of sick people increased, the number of dead people is also alarming, and the city's hospital gives no longer supply. From many places in the world, it has arrived drinking water, food, and medication. Here, I have with me the Dr. Claudia Rodriguez Colon to remark details about this situation. Doctor, why the number of sick people increased?
Well, there is no cure for this virus and neither a specific treatment. Also, the virus is contagious by the corporal fluids, and here many people share the personal objects. Equally, the sanitary conditions are terrible, and for this reason, the number of infected people continues to increase.
What we can do to prevent new infections?
Well, we can keep the sick person far away to the population and do work of cleaning and preparation. Many doctors have imparted cures about the personal hygiene, and we have to try to contain the epidemic.
Has been enough the support of the international community?
Yes, many countries have helped us. Nations like Cuba, Brazil, China, and organizations like the Red Cross have sent doctors and food for Sierra Leone's people. Without that help, the epidemic would be much bigger and the number of deaths would be catastrophic. However, it is necessary a bigger international collaboration for appease the epidemic.
Doctor, will Sierra Leone be able to recover itself of this situation?
No, without help. Sent to the internationalist doctors, the number of patients have diminished partially, and we think that some days Sierra Leone will recover. But I think that Sierra Leone's people need help.
Well, with the doctor's opinion, we return the signal to the central study. I am Dario Gabriel Sanchez, and this is Fast News. Thank you, Alejandra.
Thank you too, Dario. Now we have in the set a specialist from the World Health Organization, Diaz-Santos. Thanks for joining us. As you all could see in the report of journalist Dario Gabriel Sanchez, the Ebola is a problem that demands attention. What is the World Health Organization doing to prevent the loss of human lives in Sierra Leone, Africa?
Thank you so much, Alejandra, for having us. Thank you to all your team. Indeed, we are working with London University's hospital as well as other institutions in Germany and Belgium in order to find an experimental solution to get an effective response to virus from an ill body. There is no result yet, but as this is a sanitary emergency, we hope to find a solution soon and stop the outbreak.
Do you have any piece of advice to the families of the victims and the people in Africa?
Well, a total of 27 new confirmed cases were reported in Guinea and 8 more in Sierra Leone. So both countries people constantly move from one point to another, trying to escape from the virus. That makes it even harder for our doctors to target all those vulnerable communities. So we ask people to stay home and keep strict sanitary measures and wait patiently for our doctors to go there.
Thank you very much once again. This is all for today, but tomorrow we will come with more, because wherever the news is, Fast News will take you there. Thank you very much. Have a good day.